Open communication about mental health with your children is important now more than ever. Parents need to be aware of the different types of mental health challenges to better understand their own well-being and pick up on signs on what is happening within their families. Sometimes this can be very difficult and challenging to have that very first conversation about mental health with your child, and that is totally fine. It can oftentimes be tough knowing where to start and how to start a conversation. But opening up and talking about the topic earlier on can lead to better things down the road. Being open about mental health with young people could also mean they would open up to you and feel more ready to seek help sooner than later. But what if your child is not ready to talk to you yet? Oftentimes, due to the stigma and silence in society attached to the topic, can lead to avoidance of the topic, or your child may just be having a difficult time processing what they are going through on their own, let alone speaking to someone about it. This can, of course, be very tough as a parent, as you want to ensure their safety and well-being. So, what can you do to start a conversation and show support for your child experiencing a mental health issue? Well, simple things like finding the right time and space, and letting them know that you are there for them and happy to talk about anything with them. Or simply giving them room to open up in a way that may be easier for them, by perhaps just asking them open-endedly about how their day was. Most importantly, it is important to let your child know that you are okay with the topic and your support is available, and reiterate the fact that they are not alone. Remind them that in fact mental health issues are very common and should not be something to be embarrassed about and fear being judged. Unfortunately, children oftentimes become isolated because they may get the impression that their family does not want to deal with them. They may have feelings of being unheard or avoided. A child may indirectly make statements or express signs about difficulties they're experiencing, but not necessarily receive the response they're looking for. They may be told by a family member that nothing is wrong, you are fine, don't stress or worry, and move on with life. The family member may not realize how this can be very detrimental in a child's life. Rather than bringing them closer, they are pushed away. As a parent, you should ensure you do gestures that make your children feel understood and safe, and not make them feel in any way rejected or misunderstood. Some families can also, on the contrary, become too overprotective if they know their child is experiencing problems with their mental health. Although care and protection is good and needed, oftentimes there being too much of it can be counterproductive and make a child feel as if there is something wrong with them, or that they are less capable. This can lead to further isolation, sadness, and lack of confidence or self-worth. So remember, if you, as a parent or a caregiver, are open to talk about mental health with your loved ones, then this is setting a perfect example of role modeling to your children that it is okay to talk about such problems, which would also give them a feeling of comfort, and having that open communication would remove the stigma, and that on its own can make a huge difference.